For the first time in their lives, many people are focusing on their mental health and that of their loved ones, which is a very good thing, but not always something you can do on your own. So where do you turn to for help and guidance, especially at a time where face-to-face consultations are not always possible? Robin Haynes gives us an option with Emerald Psychiatry.
I am joined now by Dr. Scott Yoho. He is the owner and medical director for Emerald Psychiatry and TMS Center. Thanks so much for spending some time with us today, Doctor.
Well, thanks for having me. It's a pleasure to be here.
Now, this current crisis, we know, has put an emphasis on mental health, and an emphasis that we really, I feel like, haven't seen, at least in recent times. It must be satisfying to know people are taking this seriously. People are kind of taking note of their mental health, right?
They are, yeah. I mean, patients are experiencing new symptoms that they haven't experienced before, whether it's depressive symptoms or anxiety, feelings of, feeling overwhelmed, or just the uncertainty of not knowing what's happening. So, America's mental health needs have been drastically underserved anyway. But I think at this time, people are reaching out a little bit more and recognize the need to give these things attention.
What would you say the most important reason that people should focus on their mental health, that should be a top priority when we think about this crisis?
Yeah, I mean, it's just important. It's one of the most debilitating factors if you look at why people miss work. Depression is right up there with heart disease for one of the biggest issues that we face with disability. And if our mental health is not good, our physical health can suffer as well.
You are not alone in having to change the way that you treat patients. Telemedicine has come a long way, and how have you adjusted to that? What has that been like for your patients?
I don't think that there's a field of medicine that's better suited to help patients from afar than psychiatry. We don't really need to touch our patients often, so doing distance treatment is a very viable medium for us. So we actually, traditionally it's been a little bit difficult to get payers, insurance companies to approve telehealth, especially if you're not in an area of need or underserved area. But now they said, hey, look, everybody needs to try to do social distancing. So, go ahead and do the telehealth, not just in psychiatry, but other fields. So it's a pretty rapid change for a lot of people, including us. But we do use a HIPAA-compliant platform called Doxy.me. It's actually pretty neat that for your viewers or anybody looking at this, it's just kind of like this. You see your provider on your phone or on your computer. It's really simple. Like, we actually can send you a text message. You hit the little text message thing. It asks you to activate your camera, and you just put in your first name. And when the doctor's ready, you just open up and you start talking to them. And
so when you talk about opening up, what are some of the conditions that you treat? What are a lot of the things that you're helping people with today? Yeah, our office specializes in a pretty broad spectrum of mental health conditions. So we do treat a lot of depression, anxiety, insomnia, substance issues are something we treat. We are treating patients from 16 and up now. And so we're pretty well versed. I'm very lucky to work with 5 excellent nurse practitioners. So we have 6 practitioners here right now. And I mentioned that you worked as part of your facility as a TMS center. Explain to us what that is and what kind of person would benefit from that kind of treatment. Sure. Yeah, so TMS is transcranial magnetic stimulation. So what we do is we have a strong magnet. There's no magnets around your head. The chair kind of looks like a dentist chair. And there's a compartment in the back that has a big magnet. And when we run an electronic current around the outside of it, we can generate a pulse strongly about that far. So just strong enough to kind of get through your skin and your cranium and stimulate this left prefrontal cortex area that's been shown to respond to depression. So unsurprisingly, patients with depression, when you compare a PET scan of their brain to someone without depression, PET scans measure cellular activity, so how much glucose and oxygen is being metabolized, basically just how active the cell is. Patients with depression have areas of the brain that are significantly less active. So the idea is if we can give it a little jump start, it'll start creating those neurochemicals like serotonin and norepinephrine that help to modulate mood. So those patients are the only patients we actually have coming into the office, and we've taken significant extra precautions to make sure that they get the care they need. We're taking every employee and every patient's temperature and screening for any issues of COVID. You're with a treater every day, but we've moved the treater outside of the room, so they sit there and can still talk to you in the doorway, but they're or just having some physical distancing. We have little homemade masks for all of our patients, and I put in some extra air circulation. So we're taking the safety issues very, very seriously.
Okay, I do want to mention, so to that end, you are accepting new patients because telemedicine obviously has come such a long way. So if somebody is out there today, if a viewer is out there thinking, you know what, this is a good time, I'm noticing these symptoms, I need to talk to somebody and get help, what is the best way to reach out to you and your team?
Well, that's the interesting thing is, like, if anybody's tried to get a psychiatrist before, it's very common for them to have, several month waiting lists, but we do have some availability right now. So we can get patients in a week or two, sometimes even shorter. So people can call our number. It's 614-580-6917. If they want any more information on what we do, what we treat, the TMS treatments, they can go to our website, which is emeraldpsychiatry.com.
All right, Dr. Scott Yoho, Emerald Psychiatry, as he said, thank you so much for being with us today.
Thank you for having me.